Hello, and welcome to today's webinar. We're so glad that you can join us. My name is Sarah Muller-Robbins. I am the Director of Education for the Partnership for Maternal and Child Health of Northern New Jersey, which is providing today's program. Just a few pieces of information before we get started. After the presentation, you will be given the opportunity to complete a post-program evaluation. An hour after the webinar ends, you will also receive an email with a link to the same evaluation. Please complete the survey to provide us with feedback on the program. To receive a certificate of completion, you must listen to the entire webinar and complete the evaluation survey. Certificates of completion will be sent via email 1 week of the webinar broadcast. This program is being recorded and will be available on the partnership's website. We will be muting all attendees' microphones during the presentation, but we would love to hear from you. Please write questions in the question box and the speakers will respond to as many questions as possible at the conclusion of the presentation. Now I would like to present our speakers, Judith King and Giselle Alawi. Judy King is the manager of the Perinatal Addictions Prevention Project at the partnership. Judy has been in the field of addictions for 35 years. In addition to being a licensed clinical social worker, she is a licensed clinical alcohol and drug counselor and a certified perinatal addiction specialist. Giselle is a master's level counselor who has been working for the partnership for the past 14 years, 11 as a perinatal addictions prevention specialist. So Judy, I turn it over to you.
Thank you, Sarah. Sarah has already explained about getting completion and nursing or CADC recertification credits. Today, we're going to look at what constitutes a codependent relationship, how it may happen, how to recognize it, and some of the characteristics of a codependent relationship. We'll also discuss ways to change those codependent behaviors. By the end of the webinar, we hope you will be able to use what you learn here with your clients, patients, and even within your own family. Codependency is a specific relationship addiction characterized by preoccupation and extreme emotional, social, and even physical dependence on another person. The codependent person becomes so enmeshed with their loved one that they lose the sense of who they are. Sometimes the person doesn't even recognize that they're a codependent. A codependent doesn't have a great deal of trust in the relationship. They may constantly check on their loved one and worry when they don't respond. They have a fear of abandonment. Control helps the codependent feel safe and secure, but it also limits their ability to share feelings. They'll try to control situations and activities. Manipulation is connected to control. They may try to solve someone else's problems or try to change the person. However, they're also suspicious of receiving love, feeling that they don't deserve it. Most beliefs are that codependents are women, since traditionally they are the caretakers. But men can be codependents too. Unconsciously, the codependent allows the other person to continue his or her undesirable or irresponsible behavior. Those behaviors can be addiction, physical or emotional abuse, someone who's very demanding or controlling, or even somebody that's very distant, or perhaps gambling. Codependency was originally associated with alcoholism and addiction. The codependent was sometimes referred to as the co-alcoholic or the enabler, and was normally thought to be the spouse. However, codependency occurs when there's a one-sided relationship, where there's an imbalance of power in that relationship. It could be a parent rescuing their child and allowing them to continue their behavior. Maybe the child is using substances and the parent is always trying to rescue them and cover up for them, and it enables that child to keep using. It can be a sibling that is shielding her brother or sister who might be using drugs or skipping school, and they enable them to keep using those behaviors because they'll lie to their parents, they'll cover for their sibling. Or it could be a friend. When in two friends, and one is always making this decisions for the two of them, where they're going to go, where they're going to eat, what movie they're going to see. And the codependent in that friendship relationship will never say, well, no, I don't really want to see that movie, or I don't feel like Italian today. They will just go along with what that other person says. In a work situation, it can also happen where one person will kind of use the coworker. The coworker doesn't know how to say no and will fix the other person's work if it's not right, will do some of their work. Oh, I want to leave early. Can you finish my work for you? And the codependent in that relationship doesn't know how to say no. Many codependents, their traits can be learned behavior and even intergenerational. If you watched your parents in a codependent relationship, you learn what you think a relationship should be, and you may repeat those. Or a person could have been raised by parents who told the children that their feelings and thoughts weren't important. They bring those repressed feelings into a new relationship. Another risk factor of codependency is being raised in a family where there's a mentally ill or chronically ill family member. When all the focus of the family goes to the one who is ill, others may learn that their needs are not important. The caretaker can also develop codependency due to only worrying about the ill one's needs. But it should be noted that not all caretakers will develop codependency. It depends on how they deal with that illness in the family. And not all children raised in a home with an ill loved one develops codependency. Much of it depends on how the family handles it. Sometimes if there's a member of the family, a loved one that's ill, extended family will come in and help with the other children and give them the attention that they need and let them know that what they're feeling is okay. So a lot of times it could be extended family, it could be a mentor, it could be a teacher at school that helps that person get through that, and they may not develop codependency. So another risk factor is if someone was raised in an abusive family. That abuse could be emotional, sexual, or physical abuse. The adverse childhood experiences can result in lasting psychological issues, especially denying feelings as a way of defense. Someone raised in an alcoholic home may very well marry an alcoholic because that's what they know and that's what they're comfortable with. Sometimes men that are raised in a home where the father is always hitting the mother grows up thinking that that's how I'm supposed to respond to my wife. And that can cause the wife to become very codependent. It's important to note that not all codependents are weak or passive. Being in control of someone else's needs can sometimes make the codependent feel strong and in control. So codependent couples become very enmeshed and involved with each other, and there's a lack of boundaries. Now, these couples can be heterosexual couples that may be married, living together, or even just dating. But codependent couples can also be same-sex couples. There are several reasons why couples that there's some codependent relationships involved in it. Why do they stay together? Well, there may be children involved, and sometimes couples will stay together for the sake of the children. They think it's better for the children. And sometimes it may not be, but that's their perception, that they need to stay together for the children. Many women stay because of financial issues. Not all women, we know that women get paid less than men, but also if they're maybe uneducated or limited education, or they have never had a job experience, so they're worried about how am I going to take care of myself and how am I going to take care of any children that might be involved. So they would stay together even though it's an unhealthy relationship. They also feel like if they've been together for a long time, it just is not, you know, a good thing to separate. And both may feel that they're getting something out of the relationship. One finding satisfaction in being needed, and the other getting all their needs and wants met. So let's take a look at what a healthy relationship is as opposed to an unhealthy codependent relationship. In a healthy relationship, two people rely on each other and they love and support each other, and they find value in that relationship. In a codependent relationship, one person may feel very worthless, and they're not, you know, they shouldn't get love. You know, all they want to do is take care of the other person, and my needs don't matter. So it's not a mutual respect. In a healthy relationship, both make the relationship a priority, and they can find happiness outside that relationship, not cheating, but okay, you know, the wife may want to go out to the movies with some of her girlfriends to see a chick flick that the guys don't want to see, or you know, the husband gets together with his buddies to watch football, and the women aren't interested in that. And if it's a healthy relationship, you're not threatened by those outside interests. In a codependent relationship, if that codependent sees the other person going out a lot, they start feeling like, you know, what's going on? Am I going to lose him? Why is he going out? Why is she going out? Those kinds of things. So there's no outside interest for that codependent person. In a healthy relationship, feelings are expressed freely, and everybody's needs are met. There's good communication. And the codependent, in a codependent unhealthy relationship, that codependent doesn't feel like their needs and their feelings and their emotions are important. So they hide them and they won't express them. So just to restate some of what we've already talked about, one of the symptoms of codependency is always trying to make the other person happy by doing everything they can to please them. Remaining in an unhealthy relationship is not worrying about their own satisfaction. A codependent can experience anxiety and stress and feel guilty thinking about their own needs. Many have a need to be liked. You have to like me. If you don't like me, something's wrong with me. And oh, they always need to be in a relationship. If they're not in a relationship, they have nobody to take care of. So they always need to be in some kind of relationship to take care of that other person. So now I'm going to turn the webinar over to my coworker, Giselle Alawi. Please bear with us as we make the transition.
Thank you, Judy. Thank you, Judy. Okay.
You're welcome, Giselle. Yep, go ahead.
Okay, so Judy, you're absolutely right. Codependents, they suffer a great deal of stress and anxiety. And just like someone with a substance use disorders, without help, they can self-medicate their feelings, developing both physical and psychological problems. As a result of that constant worrying for others, I mean, it's really hard to watch and witness families going through. Codependents have low self-esteem. They look for anything outside themselves to feel better. They may not feel not good enough, constantly comparing themselves to others. The tricky thing about self-esteem is that you may think highly of yourself, but in reality, you feel like unlovable or inadequate. This is usually unconscious. Guilt and perfectionism often goes along with low self-esteem. If everything is perfect, you don't have to feel bad about yourself. An example of this is a mother taking care of everything in the house, cleaning, cooking, keeping the house in order, organizing. You're pretty much the perfect housewife, or forgetting that she's also more than just a mom. She's also a woman, a person with needs. A second symptom of codependency is people pleasing. Saying no causes a great deal of anxiety. On codependency, it's very hard to say no to anyone. Therefore, overcommitting oneself to too many unwanted commitments. Example, having 2 more jobs, working 2 shifts, over exhausting oneself. They have serious problems with boundaries. They get lost in others. Let's talk about boundaries for a minute. This is an imaginary line between you and others. Very important to have in order to protect oneself. We have boundaries for many aspects of our lives. For example, a boundary in how much money we spend, right? Having some limits, boundaries for our bodies. But we also need boundaries for our feelings, thoughts, and needs. Here's where the codependent gets in trouble. They have weak or blurry boundaries, or no boundaries at all. Again, they feel responsible for other people's feelings and problems, or blame their own problems on someone else. Denial, again, denial. One of the problems people face getting help for codependency. The word of caution to remember is that the problem, remember, is others, not them. They don't want to face their problem. They either keep complaining or trying to fix the other person's problems. They may run away from relationships, from jobs, and never own to the fact that they have a problem. This can go for a long time. Since codependents deny their feelings and needs, they pay attention to other people's needs and not their own. Although codependent seems very needy, others may act like they are self-sufficient when it comes to needing help. They won't reach out for help and also receiving it. Not only are they in denial of their vulnerability, but also the need for love and intimacy. Problems with intimacy here refers to being often and close with someone in an intimate relationship. Because of the shame and weak boundaries, you might fear that you might be judged, rejected, or left. On the other hand, you may also fear being smothered in a relationship and losing your own autonomy. Reactivity, this is additional symptoms, is a consequence of poor boundaries. Therefore, you react to everyone's thoughts and feelings. Example, if you say something that you disagree with, you either believe it or you become defensive. You absorb their word
because there's no boundary. With a boundary, you will realize it was just an opinion and not a reflection of you, and not for you to feel threatened by disagreement. A second example is, and I'm sure all of us have seen this, you're in a restaurant and you see a woman with a child, and the child falls down, and immediately you see people trying to help her when they don't look that, mommy's right next to her, to the child, and mom can take care of it, right? That rescuing. Codependents have very good intentions. They try, oops, sorry about that. Okay, I'm still in this slide. So codependents, they have good intention. They try to take care of a person who's experiencing difficulty. Caretaking becomes compulsive and defeating. Caretaking is another effect of poor boundaries when you think about it. It's that someone else has a problem and you want to help them to the point that you give up on yourself. It is natural to feel empathy and sympathy for others. Codependents put other people ahead of themselves. They keep trying to save the other person, even when the person clearly isn't taking their advice. For example, how many of us have heard this? Trust me, I know what's best for you. This implies that the other person don't know what is good for them. Another example is a wife may cover up for an alcoholic for her husband, right? Or a mother may excuse for a trying child. Control. 1, 2, 3, 4. 1, 2, 3, 4. Make your bed. Make your bed. Listen to me. Listen to me. Control helps codependents feel safe and secure. We all like to have some control about the events happening in our lives, but for codependents, control serves as a way to limit their ability to take risks and share their feelings. Codependents need to control those around them because they need other people in certain way to feel okay. In fact, people-pleasing, caretaking can be used to control and manipulate people. You may also see codependents to be bossy and tell you what you should and shouldn't do. Again, we know this can be a violation of someone's boundary. An example, in this house, you do what I tell you, or if not, you must go. Dysfunctional communication. Codependents have trouble communicating their thoughts, their feelings, and needs. Of course, if you don't know what you're feeling or thinking or needing, this becomes a problem. You might not want to be truthful because you don't want to hurt someone else by sharing your true desires. Communication becomes dishonest and confusing when you're trying to manipulate the other person out of fear. Again, saying something and meaning something else. Codependence talks about others. He, she, everything, that is bad is the other, not themselves. Dependency. A codependent depends on another person for various reasons. Example, emotional, financial, caretaking. As a result, they need the relationship to have some kind of meaning in their lives, some assistance to feel okay. They are afraid of being rejected or abandoned. Many feel depressed and lonely if left by themselves too long. They don't know what to do by themselves. Many times it's hard to break these dependent and codependent relationships. Again, living badly is all they know, and they might fear change because they rather live in the misery that they know than the mystery of the unknown. Painful emotions. Codependent has an exaggerated consciousness of others and do not for themselves, and as a result, this can lead to painful emotions. When you obsess of what other person is doing, thinking, and feeling, and in return what they're feeling about you, can leave an individual with fear and anxiety of the unknown. They can also feel no love, being judged, rejected, or abandoned. As a result, it leaves an individual, a codependent, with feelings of anger, resentment, depression, hopelessness, and despair. Example, after all I have done for you, this is how you pay me? feeling, making them feel very empty. So symptoms of codependency have been seen in similar relationships with the chronically ill, like Judy mentioned, and the mentally ill individuals. This term has been broadened to include any codependent person from dysfunctional family or an ill parent. But much more we know today that is prevalent in the general population than previously thought. For example, there's issues between client and therapist relationship, healthcare providers and patients, mom with children, right? Adults with children, siblings, husbands and wives. So we've seen it across the board. So now we're going to go into this slide that shows you here's a list of symptoms that an individual may experience. So are you codependent? Only a qualified person can actually diagnose codependency. Here in the list of questions from 1 to 20, there's 20 questions, but I will only focus on 3. In this slide, I will start with slide number 3, and it says, have you ever lived with someone with an alcohol or drug problem? If the answer is yes, it tells me that someone with an addiction has been impacted by someone's, someone with an addiction has been impacted. So you are therefore, you survived it by either having a surviving role. So either the hero, the codependent, the enabler, scapegoat, the hero, or the lost child. I'm going to go to slide question number 12. Do you have difficulty taking compliments or gifts? If the answer is yes or no, instead of just simply saying, if the answer is yes, obviously, instead of simply saying thank you, codependent is to justify why, why they did what, justify what they did. Also, they don't believe they need to be compensated. They may think they don't deserve what if you are providing them with monetary means, right? They don't believe they deserve it. I also want to go to question number 14, which is found on the next slide. And it says, do you think people in your life will go down the hill without your constant efforts? And the answer here, if yes, codependents have very little faith in others and don't trust an individual capacity to grow and becoming capable of doing things for themselves. Codependents erroneous belief that another individual will make it without them. Right? So again, these kinds of questions, you can find them also if you attend an Al-Anon meeting or a CODA, because again, you want to find out if any one of these symptoms it have been impacted to you. All right, so again, it says here, any one of these, you can actually seek some help. Overlapping diagnosis. So codependent is not being recognized as a distinct personality disorder in the Diagnostic Manual of Mental Health Disorders, number 5. There are many definitions of codependency, including the one that Judy shared with the loss of self. However, if not treated, codependents can become very ill and suffer a great deal, suffer a lot. You can see similar diagnoses overlapping codependence, such as dependent personality disorder, which is individuals depending on the other in general. You also can see codependent personality in only one person. You may also see borderline personality disorder, which is again the storming relationships. Borderline, as unlike codependent, doesn't involve dependence on the other people's needs. They don't feel the need to save others. So how do we recover? We want to do, the first thing is to learn more about codependence like we did today with this webinar. All of the symptoms of codependence that we learned today, we can work on those symptoms. So therefore, in the symptoms is where the solution lies. For example, if you have problems with low self-esteem, we can work in improving it our self-esteem. There's a great book, and I'm going to actually recommend this, by Nathaniel Branden. He's the father of self-esteem movement, Nathaniel Branden. If you have problems with boundaries, setting limits, there's a great author by the name of Anne Catherine who wrote a book on boundaries called Where You End, I Begin. So the key to recovery is to start to focus on the self, which is very hard to do for codependents, because you must start feeling guilty for letting go of others and focusing on you. Remember, codependents are not used to that. All their life they have been, it's a learned behavior to focus on others and to care for others. So remember, it took years to become codependent. Therefore, it might also take a while to change. We want to make sure that, we separate ourselves immediately for those unhealthy relationships. Find new things to do, right? Find hobbies, go outside, start doing some self-care. Spend time with friends and families who are supported in your recovery, right? Realizing that the first thing we want to do is to support one another, not rescue one another, right? And another thing is we want to be, hopefully that the partner will also become aware and not to allow that codependent to continue, so to make, the same sacrifices, right? So again, the whole family system can also receive care and help. We have so much to work on. Letting go codependency is a great gift to self. Once you learn that our ultimate responsibility is to ourselves, not to other ones, right? And we learn, we need to return back to our balance, because again, because of codependencies, obviously we are many times very stressed out and over worry about the other ones. So we need to kind of find that balance, going back to that self-centered, and stop overcommitting ourselves in doing things for others, and finding that balance, right? So let's look at treatment. So treatment for codependence often involves exploration of childhood issues. We learn to become codependent. Judy mentioned it earlier. We learn this is a behavior that can be passed down from generation to generation from one another. We learn, from what we see, right? For our first parents, mom and dad. Exploration of current destructive behaviors. Understanding addiction as a family disease. Identifying self-defeating behaviors. And getting in touch with feelings that have been buried. So what are some of our treatment options? Again, education, right? I shared with you guys the two books, and there's another book here by Melody Beatty, that You Codependency. She also has a great book on codependency, No More. There's worksheets. Individuals can attend individual therapy, group therapy, 12 steps meetings such as CODAT or Al-Anon that can be used interchangeably for Codependents Anonymous, right? As a result of attending the 12 steps meetings, you once can also acquire a sponsor and learn from how the 12 steps, a sponsor in the 12 steps that has been in recovery, that has worked in the steps, the spiritual steps, can help you in this process, so you don't have to do it alone. Now, in this virtual world that we are in, many of these CODA meetings are doing virtual services conference as we speak, all throughout the globe. And I think this is going back to the conclusion of my presentation. I think we covered a lot of these topics, and I want to see if Judy and we can go back if there's any questions and concerns that we can address. Thank you.
Thank you, Judy and Giselle, for that very informative presentation. So now it looks like we have a few questions. So let's take a look at some questions from the audience. But the question box is still open, so please feel free to continue to submit your questions. So one question is, how do you help a woman who has no identity and no hobbies find an interest or a hobby outside of her marriage? This patient stays at home all day, she's agoraphobic pretty much, and has no idea what hobby or outlet that would interest her. Do you have any suggestions on how to get someone to find an interest outside of their relationship?
Well, I think the first thing, having had a mom who was agoraphobic, the first thing they need to do is get treatment for that, and to learn how to be able to go out and do some things. I know that, they can have hobbies within the house while they're working on therapy for the agoraphobia. And it depends on family members too, how supportive they are, how they will get her or him out of the house a little bit. What are their comfort levels? What are they comfortable doing? My mom was able to travel all over the place with my dad because she felt safe in the car with him. And as long as she got a hotel room that you could drive up to the door. She couldn't go into one where you had to go into the hall to get to the things. So you have to work with them. But the first thing is that person needs to get treatment for the agoraphobia, because you're not going to have interest if you're still having these panic attacks.
And I just wanted to add something to that, Judy, if you don't mind, that again, because of COVID, a lot of things are being held right now virtually. So there's a lot of social groups going on at this time. And, there's things that we can still do to help us when it comes to emotional care or physical care that we can do, teaching like such as little boundaries of saying no, right? Because it's important that if we don't have boundaries as adults, as parents, imagine how we're going to be expecting our children to, have a little set limits for their video gaming when we can't even abide by some rules ourselves. So it's important that, and I like that question because it's important to help parents by providing them, by teaching them what are boundaries, what are limits. And it can be from, limiting, like I said before, the money you spend, limiting the junk food that we eat throughout the week, limiting the time we spend on TV, on the screen, et cetera, et cetera. So setting those limits, which again, is something that you have to learn, and so that then you can then give that to your children as well. Hopefully that helps that person that asked that question.
Great, thank you. We have another question that does refer to children. Are the identifiers for codependency different for children and teens as they are for adults?
I think children, it's hard to say that they're codependent as children, but teens can certainly be codependent. As I talked about, the fact that they can be codependent for their sibling. And it's the same thing, it's, not being able to think that you're worth enough, that your sibling is more important, those kinds of things that, there's some of the identifiers I think are still the same with teens. I don't know if Giselle agrees with me, but.
Actually, the way I understood the question, I guess, was a little different the way I understood that, because usually what I see happening is like, do we have codependent parents, and how do that manifest in relationship to the children? So many parents can probably be, over involved in the children and in their lives, right? They can be over involved, and sometimes also parents can do inappropriate caretaking. Like, for example, if you're still picking your 8-year-old's clothes for what they need to wear for that day, or you're still trying to help your 16-year-old do their assignments. I mean, there's obviously too much involvement. So how does that relationship of codependent parent impact the child? So I was thinking in those ways. More. I think
too, when we talk about a teen that might be codependent, you talked about, some of the roles in an addicted family, and that hero can become very, very codependent if they're taking care of one of their parents or both of their parents that are using. They'll pick them up off the floor and put them to bed, not letting them feel, they'll make dinner so that, mom doesn't have to feel that she's not taking care of the family. He or she will enable that person to keep using because things around the house are being taken care of. As you said, they'll clean the house. So it may be the teen that is doing that, taking care of the parent. And so they can display some codependency too. And they're going to
Absolutely,
to their adult relationship.
Absolutely, Judy, and we've seen that, we've been, both of us being in the field of addiction for many years, we've seen how addiction impact families and how many of the children, they take the adult roles, and again, they don't learn how to be children. And so it's very hard. They become so responsible at such a young age. And yes, you're definitely right there. Here we go again, that codependence, that need to help save mom and dad or that sibling, taking care of so many people. So when they grow up to be adults, obviously they continue that pattern. So it's like the whole family. That's why when people ask, if an individual that has an addiction only hurt themselves, no, we know it hurts the whole family. And it's so hard for families to get that help. Mm-hmm. They don't recognize it. Mm-hmm.
I had a family years ago that I worked with, and the parents brought in their teenage son because he was using marijuana, and they only wanted to deal with his marijuana. Well, when I met with the parents, you could smell the alcohol on the mom. I mean, it was quite obvious. But dad didn't want to deal with mom's alcoholism. Just take care of my son. Well, 5 years later, I took a job at a halfway house, and the first client I met was this young man. He had progressed from marijuana to a lot of other drugs, and so wound up an inpatient and then in the halfway house. And again, met with the parents. Mom was still drinking. Dad was still in denial. The son became the scapegoat because the whole focus became on him, and dad didn't have to deal with addressing mom's alcoholism. So there's a lot of different dynamics that can go in. Dad was definitely codependent, but the son had his role in not dealing with mom's alcoholism too.
Sure.
Yeah. We have a question about asking for advice. How do you handle an individual that refuses to acknowledge your boundaries and continues their behavior?
You can't force someone into treatment, but hopefully if more people are educated about codependency, maybe there's a family member that can intervene and say, you have to have some more boundaries. You have to say no. It's the same, if there's an abusive relationship and the woman keeps getting battered, sometimes it's somebody else that says, you can't keep doing this. You can't keep doing this. So the same with the codependency, Go ahead, Giselle.
Yeah, no, Judy, you're right. You're answering that. It's like, it's really, to the person comes in terms, comes to agree with their reality and whether or not they're willing to do something. I mean, we do know the same thing with addiction and codependence. People die of this. People die from chronic medical problems as a result of their anxiety and anxiousness over somebody else's life. So we know people die from, I actually don't know people that had a heart attack, and it's like, she killed her son. No, it's not, she had an issue with her heart. But that stress level that you can imagine these people go through. And again, that person's not ready to go. And I think it's important that we let people know that there is treatment. There is the individual therapy, there is outpatient therapy, there's even inpatient therapy that people can go to. A codependent can go to a 28-day rehab. That's how lucky, New Jersey doesn't have a rehab, but all our 50 states have rehabs, right? Outpatient, there is in New Jersey for codependency. I haven't yet found, I don't know about you, Judy, but do you know of any inpatients here in New Jersey that might have a rehab? Because I looked and it was very difficult for me to find. Outpatient, yes, but not inpatient.
Yeah,
So,
I know Claudia Black has one, but I think she's in Arizona.
Yeah, correct.
Yeah.
Correct. Yeah, so there is help, and again, the CODA, many families can attend virtually to Al-Anon, which is also another name for codependence. Those words are used interchangeably, anonymous, and get help. There's help, but you need to want it and see it.
And oftentimes, if it's an alcoholic or addictive relationship, that alcoholic or addict will get clean and sober, and then the codependent doesn't know what to do with themselves, because in recovery they're learning to take care of their own needs now and what they need, and they're learning how to express their feelings. So sometimes it might be them that gets the codependent into some kind of treatment.
Yeah, I actually been asked to do talks about that, because, again, exactly. Individuals go to get help for drug addiction, and they do whatever they need to do, and then the families, when you talk to families, it's like, now what can I do? They're getting clean and sober. I said, well, can you stop worrying about them and do something? Are you willing to let go of them? But what do you mean let go of them? I said, when you need to let go. You cannot be controlling them. Again, you take away purpose out of the codependent, because they were always looking after them. Did he smoke pot? Did he need detox? But what else? It's like it's very hard, because they don't know what to do with themselves. So the whole family needs help. Absolutely, Judy.
Yep.
There's another question about how have you found different cultures affect how they deal with codependency?
I love that question. Absolutely. It's very, very difficult. Oh, yes, definitely. Especially, and you mentioned it, Judy. You mentioned it in your PowerPoint, in regards to how culturally, as women, we've been taught to take care of other individuals, right? And I definitely, looking at Latin culture, we tend to be a mother forever, right? Here in the United States, we know that each young person becomes an adult at 18, and you cut the umbilical cord. For like Latin family like myself, you could be 80 and still take care, still paying the bills. And again, so yes, definitely there's a lot of cultural thing. I think, I could only speak for Latin families. I don't know other cultures that well, but it's interesting because we are, from the animal kingdom, we're the only species that stays tied to their kids like forever, right? Even the animals, when they teach the animals how to feed and look for food for themselves, they keep them out of the herd. But right? If not, they kill them. But we are the only one with intelligence that still believe that our children should be with us until eternity, right? Until forever. So it's just interesting. But thank you for bringing that question up. That's interesting. Yes, definitely. There's a lot of.
I think too, we didn't do a lot of research on different ethnic groups and how it would differ, but we do know that many cultures in the Middle East, you don't ask the woman a question, you only ask the man a question. And I know some of the prenatal clinics have trouble with that when they try and do an assessment as to whether or not there's any abuse in the family or anything. It always has to go through the man. So is that woman codependent? You don't know, because culturally that's what they're used to.
Exactly.
And you don't know what happens once they go home. There may be clear boundaries. You don't know. So maybe some other people have some other insight into different cultures, but you have to take a look at what you've got, and when you just see them for a couple of minutes, you don't know what goes on at home.
I think the key to this codependency relationships, Judy, is the inability to share how the other person's feelings and needs are. I think that's the key. You know, you cannot have a one-way relationship. It has to be a two-way when people are being valued, like, right? It's the interdependency relationship that people bring together, that they work together, not, codependency, we learn that is something that is a learned behavior. So if you're learning, whatever you're learning from the beginning, taking care of let's say of a partner, doing their laundry, doing the cooking, eventually that's going to be taken to also the emotional side, right? So if we try to look at where this is rooted, and it's mainly, that it's not a two-way relationship, it's really a one-sided. And I think that's the key there. And taking into consideration, culturally, where people come from. If the women don't have a voice, that's an issue, right? In some cultures, that's an issue, So it's interesting to look at that in, a codependency in terms of, cultural, and how that impacts women, right?
Yeah. We also have a question related to the pandemic. I know you mentioned that briefly, but is it possible for someone who's been working for years on themselves to fall back into the codependent mode during this pandemic?
Absolutely. Without help and support, if you're not doing a meeting online, even I remember hearing during the month of March, many treatment centers, they were a little, I guess, not close, like totally, but they obviously were operating in different schedules, right? So if you can log into a meeting because, let's say, because of the pandemic, it's not happening, and you feel the need of rescuing or calling your other, the other group members, you might want to try to find a way to how, again, revive the group if you're attending a group. Also, if an individual can fall back, it's just like an addiction, you can fall back into relapse in going back to like dropping one relationship and picking up. So it's important to have awareness to continue to work on yourself, to see if these feelings or issues continues to rise. During the pandemic, I know as a mom, I want to take care of all my family, but how realistic is it, right? I mean, the children have their own roles. My husband has his own role. So I have to make sure that everybody's doing their thing. I cannot be the super mom, So yes, especially during this pandemic, we women, we need to take care of ourselves and be able to say, wait a second,
right.
Let's hold on. So yes, I definitely think that.
Yeah, because if that codependent started to get outside interests to, kind of learn how to take care of themselves, now they can't go out. So it's very easy, as Giselle said, to fall back into old habits because you can't, go out to the movies, or, you don't want to go to the mall because you're concerned, about contracting the COVID, and it's harder to visit family. I mean, how many of us didn't get together at Christmas or Hanukkah, and that it's very easy then to fall back into a codependent relationship, and the other one being happy that you're taking care of me because I can't go out either. So
absolutely, Judy.
It's a challenging time. I think we may have time for one more question. One is, how do you talk with a codependent parent about these concerns if they don't have any education on the topic, and finding a way to speak them without making them defensive, because it can be a sensitive issue?
I know when I used to do parent groups, outpatient, when I was counseling outpatient drug and alcohol clients, and even in the halfway house, sometimes you have to tell parents, whatever you learned about being a good parent, throw it out. Because being a good parent is, oh, you need a little bit of help with your bills, I'll give you some money. Or you need a little bit of help with food, let me buy you some food. But if someone is in recovery or using, you're just enabling them to keep using. And so you have to set real clear boundaries. And sometimes it's hard for parents to do that. It's hard to give up what they think is supposed to be a good parent.
Absolutely, and there's many services. I know, for example, our family success centers, they teach parents on how to be the best parent, the best version of themselves, and definitely has to do with a lot of that inner work that we do. So there is services, Sarah, available. I'm sure if you were to look into at this time with COVID, there is parenting classes being provided to different groups. It's a matter of looking for them. I know the children's system of care in all throughout the state. They have services for children and parents, and they provide coaching. There's a service for coaching for parents through the children, New Jersey system of care. So there's ways to teach parents about how to be the best version of themselves, so that they in return can expect the best of their kids and teach them. Like, for example, we talked about limitations, teach them about self-esteem, the importance of learning how to accept oneself. Again, because many of these things, they don't teach you that in school or at home, especially if you come from a family where you didn't receive this. You didn't receive the love that you needed when you were that child. And now you compensate it by, doing things for others to receive that love, right? Get accepted. So, I think it's very important for all of us. Again, we never stop learning, right? So we always need to find out what is it that we need and work on ourselves. And definitely there's a lot of self-help groups out there.
And I think too, the other part of that question was, how do you make sure that the parent doesn't get defensive or the codependent doesn't get defensive? And I think any counselor knows you start where the client's at. And sometimes it's a very slow process, well, what are your outside interests? Well, can we get you interested in one thing? What one thing would you like to get interested in? And so sometimes that recovery is a slow process, because you don't want to just say, oh, you're codependent, you got to change things. That's not the way to do it. You have to say, what are you doing? And what about yourself? Where are you? How do you feel about things? Helping them get in touch with their feelings and start slowly getting them interested in things for themselves.
Yeah. Great. Thank you so much. That was a great way to end. And that's all the time we have for questions today. But thank you to Judy and Giselle, as well as Monica Smith and Karam Amadeo, who are handling the technical back end of the program. And thanks to all of you who have joined us today and all the questions and interaction. A reminder that you will be invited to take a post-program evaluation immediately after this webinar has ended, as well as an email approximately in an hour. Your feedback is important, so please take the time to complete. The certificates of completion will be sent via email you provide on the evaluation, so please check to make sure it is correct and should be received within a week. We also have more exciting professional educational programs coming. Look out for our webinars upcoming on cervical cancer etiology and treatment, and an interdisciplinary approach to increasing HPV vaccination rates. A calendar of the partnership's upcoming virtual programs can be found at www.partnershipmch.org under the Professional Education tab. We also offer on-demand recordings of many of our programs, which are listed there as well.